Let's turn now to Washington Post staff writer, Newsweek columnist, and MSNBC contributor Ezra Klein. Good evening, Ezra.
Good evening, Keith.
I think even I get the implication of a spike in sales of insurance programs to small businesses, but explain it anyway.
A spike in sales of insurance to small businesses during a horrible economy in which they're going out of business. That's pretty much unprecedented, and what it means is the small business tax credit that is going out across the country, what we're seeing is much larger take-up than we anticipated, and they're taking it up because it's finally made it affordable for them to offer insurance for their employees. That LA Times article, if you can get your hands on it, is actually a pretty powerful document, because you have these business owners in there who are clearly agonizing for years that they couldn't do this for their people. They said, finally it came, and it's been perfect. They got a restaurant owner in there. She says, every chef who works for me, we're able to get them health care. It's been wonderful. It's mattered. And
it's not the knee-jerk response to opponents of health care reform would say, well, that's the part of the mandate, right? The mandate doesn't kick in for years yet. It doesn't have anything to do with you have to do this. They chose to do this.
No, the mandate is not operative here at all.
All right. Is this exactly what happens when even a flawed minimal health care reform law like the one that passed last year has gotten into effect 9 months and the benefits start to become quantifiable?
Absolutely. These benefits are trickling in. This is one of the first major ones that's really come in. But now repeal is going to mean taking this credit from every one of these small businesses. These chefs are going to become uninsured once again. And this is going to be the difficulty for the Republicans going forward. The CBO came out this week, and as you mentioned in your introduction here, they said, you know what? You guys are going to cost us $230 billion if you do this. And by the way, you're also going to mean 32 million people don't get insurance in the next 10 years. The good thing for the Republicans is most of those people don't have insurance yet. If they did, there'd be no way to do this at all. But the thing that Democrats have learned when they tried to pass health care reform is that things are popular in general and they get unpopular when you get specific. And Republicans are about to find out the same thing. They want to repeal it all. Well, they're repealing all the popular parts too. And we've pulled that a lot. When you try to repeal the popular parts of health care and ask the American people about it, they don't like that one bit.
So Speaker Boehner already dismissed the CBO as their opinion. Should Democrats thus, not only because of the results of the sort of anecdotal evidence out of the insurance industry, but should, because of Boehner's attitude towards this and your point about specifics versus the general, should the Democrats relish rejoining this fight over health care reform on that specific level?
They should be going to war over it. It's an incredibly important achievement for them, and if Democrats cannot